Hello, my name is Dr. Joseph Danyo. I'm a board-certified plastic surgeon in Greenville, Delaware. I am approximately 40 minutes from Philadelphia and just a few minutes from downtown Wilmington. What we're going to do today is talk about Botox. Botox is a very interesting molecule. It's been on the news, and I'm sure you've heard all about its use. What I'd like to do is review its uses, how it's administered, and what you can expect after you have your treatment. So this is a bottle of Botox. It comes freeze-dried and frozen. To make it active, we add a saline solution to it. When the saline solution is in, it becomes a active molecule. What Botox does is it disrupts the transmission of the nerve signal to the muscle, and therefore the muscles that are causing the wrinkles are going to be diminished. There are basically three kinds of wrinkles. There are muscle-created wrinkles, like these rows of wrinkles going across my forehead are caused by my frontalis muscle. This frown here is caused by the glabellar muscles, and then crow's feet caused by the orbicularis oculi muscle. There's other uses throughout the face that are less common. Typically, muscles creating these wrinkles are most commonly treated. However, there's also gravity wrinkles. For instance, the nasolabial fold or the laugh line. It's caused by the cheek descending over this fixed point. And that is a wrinkle that is not treatable by Botox because it's not being specifically caused by muscles. In order to Botox this area, you would have to Botox your smile, which obviously you would not want to do. Then there's environmental wrinkles, wrinkles caused by age, sun damage, smoking, and they are typically the fine lines throughout, and obviously those are not Botox muscle type wrinkles. So the safety of Botox is exceptional. There's essentially no allergies to Botox. It is injected locally. It does not circulate throughout the body. The doses that are used are exceedingly small and have no interactions with medications or other disease problems that you may have. So this is a typical Botox needle. It's a 31 gauge needle, which is very, very small. And typically the medicine is injected to 1, 2, or 3 of these areas that we talked about. So for instance, for the frown, 1, 2, 3, 4, 5, 6 injections. For the crow's feet, it tends to be 1, 2, or 3. Forehead, it tends to be up here and middle and here, generally not above the eyebrow. We spoke about the safety of Botox. Medically, it's very safe. Does have some drawbacks related to mechanics, and if you place the injection too close to the eyebrow, it is possible to get a droop of the brow or eyelid, and therefore proper technique is required, and fortunately those side effects are very, very uncommon and preventable. So once the material goes in, it takes about 2 to 4 days for it to begin working. It generally lasts about 3 to 4 months, and as you become more of a repeat patient using the Botox, it can start to last 5, 6, or sometimes even 7 months after a year or 2. Cost for typical treatments is in the range of perhaps $300 for this area, up to maybe $700 or $800 for maximal treatment of forehead, heavy crow's feet, and heavy frown lines. At 3 months, it is working great, and it does tend to trail off by 4 months, and you return back to your original state. So there's no long-term problems stopping and starting, having delays in between. It is purely just a matter of wrinkles, no wrinkles. That is the end of our little introduction to Botox. If you have further questions, you're of course welcome to email me through my website at drdanyo@danyobamburyps.com. You can also, of course, call the office for a complimentary consultation at 302-888-0508. Thank you.